In the face of diseases new and old, ID experts can make a difference not just by engaging in research and clinical care, but also by advocating for patients in front of lawmakers and policy drivers. Andrew Trotter from the University of Illinois Chicago is here to tell us all about his advocacy work. Thank you for joining us and being on the show.
Yes, thank you for having me.
So gender-affirming LGBTQ inclusive care is really critical and vital to the work that you do. How does that influence the advocacy work that you do?
Yeah, throughout my whole career, LGBTQ health and gender-affirming care has been very important to me. And it's something that's in the public eye these days and is a subject of legislation. And those of us that are doing the work, we know how important it is to have safe places for people to get health care, comfortable places, but also to be able to get comprehensive care in an environment that they're comfortable with. And I think the impacts of some of these discussions and the legislation, people don't always understand how it impacts individuals and people in their communities. And so I think it's very important for us as practitioners, to be able to share that with lawmakers and people who are looking at these subjects as targets of legislation or different policies, to really understand how it impacts people's well-being and their health. And I think that it's just an important way that we can use our voice and our experience to share that information so that they understand the human impacts of that and the health impacts of different types of policies.
Well, you actually attended the IDSA's Advocacy Day on Capitol Hill. What would you say are the key standouts that you want lawmakers to keep front of mind always in the future?
Yeah, I think that there's kind of three main ones that come to mind. So foremost, I'm an HIV practitioner. I treat people with HIV and HIV prevention, and it's really important to continue to have federal funding for those programs, and also to make sure that it's growing as our needs are growing. It's just really critical. HIV has changed so much over the decades to a chronic treatable disease, but we need to have the services available, and we need to be able to reach everybody who needs them. And with that, we need funding, and a lot of the funding comes from the federal level. So being able to talk to lawmakers about the impacts of changes in funding and why it's needed is really important, so that they understand their constituents and the communities, how they're impacted by those changes. The second thing that I also think about is the workforce. We have a big issue with shortages of infectious disease practitioners in many parts of the United States. And so there are initiatives through the IDSA and HIVMA where we've been really trying to look at ways to get people interested and engaged into infectious disease as a profession. And I think part of that is also having lawmakers understand all the diverse things that infectious disease specialists do and how it impacts the community and individuals in their communities, how we serve so many different functions, from public health to hospital care to treatment of immune suppressed patients, HIV care, infection prevention. All these things, they impact people in many different ways. And so being able to strengthen the workforce is really important. And the third thing that I think about is a national PrEP program. So for a long time, there's been efforts to try to make a comprehensive program across the country to allow access for HIV PrEP, so prevention methods for HIV, because it's hit and miss. The programs are all different on states. And so really trying to create a more robust national program will ensure that people across the country have access to very effective HIV prevention tools.
So when it comes to those ID experts you mentioned, are many involved in advocacy? Why should they be? And how does it directly impact the patient care?
Yeah, I mean, one of the great things about advocacy is I get to work with ID specialists from around the country, and it's a great community to work with. But I think that it's important for people of all training, so attending physicians who have already graduated, fellows, medical students, residents, all to become involved in advocacy so that our voices are heard. We're a diverse community, and we do diverse things and work with diverse topics within the communities that we serve. And so having the voices there to provide that information about the effectiveness of our services and why funding and different programs are important is really paramount. And to do that, we need a robust representation of all the people that do infectious disease all across the country. So it's really important for people to be involved. And there's different ways. I mean, it can be as simple as sending emails, but we do Hill Days where we meet with legislators, and you can also do it in your local community because they have offices there. And sometimes they want resources. They want to understand the impacts of the policies that they're having to, make decisions about. So it's been a really great experience to be able to develop those relationships and be able to share the experiences of myself and also the patients that I serve and in the communities that they represent.
Nice. Well, thank you so much for your time and joining us here today.
Thank you for having me.